I think the biggest benefit of hospital at home for the patients is that they get to recover in their own homes. We can do exactly the same things that we're doing in the hospital. We can give IV medications. They're having a physician visit every day. Nurses are coming and seeing them once or twice a day, but they don't have to be in a hospital bed.
The multidisciplinary team that cares for the patient in hospital at home is the same that you would get in the hospital.
We have an occupational therapist, a physiotherapist, rehab assistant, speech and language pathologist, and a social worker. And our multidisciplinary team can provide comprehensive treatment and supports to our patients.
The level of care is great. They're always there to answer questions if I had any. And they were pretty prompt when they say, I'll call you at 9. That means they will call at 9, and they're always available. That's the other thing.
I've been amazed at what we can actually look after at home that we would traditionally think has to be looked after in the hospital.
Once a patient is considered a candidate for hospital at home, that's when our education commences. So the patient will have one-on-one time with a patient care coordinator, a clinical nurse educator to go over all of the information and the technology provided.
They made me feel very part of the program, made me feel very relaxed and very capable of it. They were just so knowledgeable and I just felt really safe with them.
I felt very comfortable because they had prepared me properly. And if I did have any questions, they were here for me or I could phone them.
While we appreciate having this kind of technology, we also have methods of pen and paper and writing down, and we are in contact with people via the phone and really want to make sure that we can reach a broad audience and that the technology shouldn't be a barrier to being part of hospital at home. Once the patient arrives home, the nurse will meet them there with all of the equipment and help them get set up.
We want the patients to feel empowered, supported, to ensure that they are fully part of their own care and they feel confident in being part of the hospital at home program.
With one phone call or with a call bell, a nurse would answer if there's any issues at all.
The virtual call bells are provided to each patient as an added layer of safety for being able to get a hold of nursing 24/7 in hospital at home. All they have to do is press the button and it's a direct line to nursing.
If a patient's medical needs require them to return to the hospital, or if there are any challenges, they always do have the option to return. This decision is usually made in collaboration with the patient, the hospital at home care team, and family.
And if at any point in their stay we felt that they needed to come back to the hospital, we would bring them back.
I think the sky's the limit for hospital at home because we can do the same job or even a better job in this wonderful environment where patients thrive.
You're in the comfort of your own home, but you're also getting the primo care that you need.
It was amazing to come home on this program. I slept so well. My appetite improved so well. My whole mental attitude changed. And also what was great was that just a call away, it was hospital at home if I needed them.
I was 100% for it because I felt that it would be a quicker way for him to improve. And I knew they'd have the professional people to help us along the way.
I think the hospital at home program is going to markedly change the acute care patient's experience. We have the opportunity to provide acute care level services to people in their own homes. We adapt to the patient in their environment. We're not asking the patient to have to adapt to the institutional environment. I think it's an exciting program for healthcare in BC for us to be able to give patients this opportunity.